As the death toll from the new coronavirus climbs, questions remain about how it spread to humans and how much of a threat it poses across the world. Cases have been confirmed in the US, Japan, South Korea, and Thailand, while there are understood to be 9 suspected cases being tested in the UK. Now, fears are growing that the increased travel expected over the upcoming Lunar New Year period could aid the spread. But just how worried should we be in the UK? What is it? A type of virus. As a group, coronaviruses are common across the world, say Public Health England. Typical symptoms of coronavirus include fever and a cough that may progress to a severe pneumonia causing shortness of breath and breathing difficulties. Generally, coronavirus can cause more severe symptoms in people with weakened immune systems, older people, and those with long-term conditions like diabetes, cancer and chronic lung disease. How does this compare with previous outbreaks? Several experts say the new coronavirus appears to be less severe than its predecessors. Paul Hunter, professor in medicine at the University of East Anglia, said typical flu epidemics can kill tens of thousands of people, but that previous new coronavirus outbreaks have led to fewer deaths. For example, severe acute respiratory syndrome, SARS, killed about 800 people, while Middle East respiratory syndrome, MERS, led to about 450 deaths. Professor Hunter said, "This new strain seems to be rather less lethal than the previous 2 outbreaks, however this could still change. All new outbreaks are worrying, especially in the early weeks when it is not clear how the outbreak could progress. I think it unlikely that the Wuhan coronavirus will cause a major public health issue in the UK, in large part because of our existing health system." US researchers writing in the journal JAMA also said the fatality rate appears to be lower than that of SARS or MERS. Catherine Pauls and colleagues wrote, "The extent, if any, to which such transmission might lead to a sustained epidemic remains an open and critical question. How easily can it be transmitted?" The World Health Organization, WHO, said on Thursday it was too early to declare a public health emergency of international concern. The body said there is evidence of transmission between people in close contact, such as families or those in healthcare settings. But it said it has not seen any evidence of onward transmission. Dr. Andrew Friedman, reader in infectious diseases at Cardiff University, said it is not clear how contagious the virus is. He said, "This is important in determining the risk of a much larger outbreak developing, with spread to people who have not traveled to Wuhan. It is likely that the US and other countries will be considering WA. For more on this story, visit the news article link.